Hello everyone, I am Dr. Mohammad Muzammil Sangani from Karachi, Pakistan. It is great pleasure for me to present my study on APOA platform. I am going to present my study on role of mini-CM in Orthopedic Emergency Department, Karachi, Pakistan. Is to save time, money and radiation exposure. On disclosure, the author has no conflict of interest that need to be disclosed. Introduction. Annually in USA, approximately 2 million emergency departmental visits were documented, mostly in adults due to upper extremity fractures. Despite of aggressive campaign for injury prevention, there has been increasing overall rate of fractures. Approximately half of all children during their childhood suffer from the fracture of the bone. Close manipulation and reduction of the fracture in the emergency department is the commonest procedure performed by the orthopedic resident and surgeons. Most emergency departments use radiographic images as diagnostic and post-relocation reduction confirmation tool. In pediatric patients, as we know that reduction in radiation exposure is of being paramount importance because their cells are more sensitive to radiation. So the smaller CM fluoroscope imagings are now frequently used for the fracture treatment in the accident and emergency department and also in and outpatient orthopedic procedure because they are more portable, convenient and easy to use devices. As we know that CM is an imaging scanner intensifier. The name derives from its C-shaped arm which used to connect the X-ray source and the X-ray detector to one another. By using the mini CM in the emergency department, we can reduce patient as well as attendant suffering in roaming to the radiology suite and wheeling back in orthopedic bay with post-manipulation X-rays. Often sedation or regional anesthetic applied to this patient so they cannot be moved while they are under sedation or their regional anesthesia at work. So the objective of our study was to determine the role of mini CM in orthopedic emergency department of Tertiary Care Hospital of Karachi, Pakistan. It is a retrospective cohort study conducted on consecutive series of the patient in accident and emergency department of Jinnah Postgraduate Medical Center, Karachi, Pakistan, which is the largest public sector tertiary care hospital of Pakistan. 500 forearm and wrist displaced fractures were treated under sedation with close manipulation and casting in accident and emergency department, and data was compared with the historical control. In 250 patients, fracture were reduced and assessed with a mini CM device, while in 250 patient manipulation results were evaluated with plain radiographs. Age range from 2 to 60 were included in the study with uncomplicated isolated fractures. Patients present with minor injuries, including superficial wounds, bruises, and abrasions, were excluded. Subjects eligible for the study were randomly divided into two groups. Group 1 includes patients in which we use mini CM fluoroscope to check manipulation result, while Group 2 patient we use post-reduction X-rays. Pre and post-reduction radiographs were also taken for each patient. On result, average age in each group is the same, around 30 years and 31 years, while on gender specification, control group have more males, while mini CM group have more females. There was significant improvement in reduction quality seen in fracture undergoing close reduction with mini CM assistance had an average angulation around 7 degrees, while in control group is around 8 degrees plus minus 5 degrees. There was also a significant decrease in repeated manipulation and need for subsequent operation interventions, like 2% in mini CM group and 8.4% in control group. And thus, decrease in hazardous radiation exposure to the patient also decreased. As we noted, conventional X-rays take more time than mini CM, so the average decrease in orthopedic consultation time with the use of mini CM group is also decreased. It takes around 25 minutes plus 12 minutes in each patient, while 45 minutes for the conventional X-rays patient. This table summarizes the result that the number of repeated reduction, consultation time, future surgical fixations and radiation exposure was decreased in mini CM group. This concludes that with the use of the mini CM in close reduction of forearm and wrist fractures in accident and emergency department can improve the quality of fracture alignment, decrease in radiation exposure to the patients, decrease in need for the repeat fracture reduction or additional procedures, and decrease in average orthopedic consultation time for the fracture management. It summarized that the use of mini CM decreased the patient emergency departmental stay, and helps to get treatment done in a timely fashion. That has really helped in early management of the patient in emergency department. Having the CR substantially improves the patient outcome as well as save time and money. These are the references. Any questions?